My name is Andrew Brod, and I'm a senior research fellow at UNCG. And my role here today is to ask you to forget about the humanitarian concerns, the moral concerns, the healthcare concerns for just a moment. Let's talk about the numbers. What I found, I've been tracking the research on the economic research on the Affordable Care Act, and in particular, Medicaid expansion in North Carolina under the Affordable Care Act, or ACA, for the past year or so. And I think it's fair to say that a clear pattern has emerged. What you find is that in study after study, as long as it's done by sort of a mainstream, non-ideological organization, you find pretty strong evidence in a number of different dimensions that that purely on economic grounds, that the decision not to expand Medicaid in North Carolina was a bad one and should be reversed. For example, a study by the Rand Corporation, no one's idea of a lefty think tank, found that the state, by not expanding Medicaid, is losing out on opportunities to cut its reimbursements to hospitals for uncompensated care. And in fact, and this is the real point, the savings that it could enjoy had it expanded Medicaid would more than offset the increased expenses from Medicaid payments and administrative expenses. So in other words, we are hurting our state's budget position by not expanding Medicaid. And by the way, I think this is also a point for why this is relevant to the City Council's discussions tonight, because the City Council obviously has a stake in the state's budget position. There are other factors.